Hi, it's Made Easy here. Today we're going to talk about some tips and information that every healthcare provider needs to know about pulmonary embolism. We're also going to give some NCLEX tips as well. They're super important, so if you are a nursing student and you're in school and you're studying for that big test, this is the video just for you. Real quickly before we get into our NCLEX tips, need to know tips, I want you also, after this video, head on over to medmadeeasy.com and check out our shop page and make sure that you specifically look for this NCLEX medication study guide and quiz. You need this if you are a nursing student or studying for NCLEX right now. This is super helpful. You don't have to search the internet, and look at that, $1.99. How can you beat that? For less than a cup of coffee, you're going to get yourself a lot of saved time, very helpful, and also something that you just can't miss out on. So anyways, with that, let's just go ahead and get straight into our tips. Tip number 1, some very important symptoms that you need to be able to recognize in a patient who potentially has a pulmonary embolism. Chest pain, pleuritic in nature a lot of times, so it's sharp and stabbing. Also worse when someone's breathing in or taking deep breaths. Shortness of air, that's a big one. Also, sometimes you'll see the hypoxia with that, so a patient will desat, usually before, a lot of times below 92%. Patients also develop a cough sometimes, and they may also feel some anxiety, or that what you hear, that impending feeling of doom. I wanted to tack onto this tip just real quickly about some physical signs that you may also see, such as hypoxia, hypotension, tachycardia, and also calf pain. This is super important because usually the clot travels, it starts as a DVT and then the clot travels up to the lungs, and that's how you end up having a pulmonary embolism. These are super important, especially if you get a test question that is giving you vital signs and you're trying to figure out what's going on. In addition, it may give you some risk factors as well and try to help you have you figure out what the next intervention may be. Let's talk about tip number 2. D-dimer is almost always increased in the presence of acute pulmonary embolism. But however, D-dimer can be increased in other conditions like renal disease, so it's important to realize that just because someone has an elevated D-dimer, that doesn't necessarily confirm that they have a PE or a DVT. The confirmation is actually done by CT angiogram. That's the gold standard. If someone has renal disease, then of course they need to do a VQ scan. Tip number 3, something that's super important to realize, especially for test questions and for just real life experience. One of the biggest things that I see for a risk factor for developing a pulmonary embolism or a DVT is definitely immobility, and also cancer quite a bit, and clotting disorders. Birth control use and recent surgery are also other reasons. It's just super important to know these things because these patients are at increased risk to develop PEs, and as you know, PEs can be life-threatening. Let's get into tip number 4. Now, if your patient has a pulmonary embolism, one of two different choices are going to be made as far as treatment. They're either going to be placed on a low molecular weight heparin therapy, Lovenox, or an unfractionated heparin therapy, Heparin Drip. There's some differences between the two. Most often you're going to see the Lovenox. It's usually given at 1 milligram per 1 kilogram BID. You're going to see that most often in patients for several different reasons. Number 1, it can be given subcutaneous, and it's a lot easier than having to deal with a heparin drip. If you are a nurse, and if you're a nursing student and you've ever had to deal with a heparin drip, you know exactly what I mean. Another thing about Lovenox is that it lasts for a longer period of time, the anticoagulation effects, which this actually can be a bad and good thing depending on what's going on with the patient. The heparin drip, it's often used if there's a surgical procedure upcoming, and that you're trying to make sure that the it has a short half-life, and so basically less bleeding risk after it's stopped. So that's super important to remember because with Lovenox the effects do last longer. Also, you don't have to do the PTT monitoring like the heparin drip. Woohoo, right? Yeah, that's exactly one of the big things about Lovenox that's great. And then also people can do this outpatient as well. Studies are showing that they're both just as effective. And the final tip, tip number 5. A lot of patients, after they go home, when they go home, eventually they end up on warfarin. Now warfarin is an anticoagulant that an INR does need to be monitored. The INR, this is super important because you might see it on test, and if you don't see it on test, you're going to need to know it for your career as a nurse or other healthcare provider. INR goal for a pulmonary embolism or DVT is 2 to 3, so that's super important. So if they're outside of that range, whether too low or too high, that's super important that you need to know that intervention needs to be taken. Well, that's it guys for this video. Give this video a thumbs up to let us know that you like this video and you want us to make more of these NCLEX tips videos. And also make sure to subscribe to our channel. We want to keep making videos for you, and also comment below if you have any certain subject that you're struggling with that you'd like us to make a specific video. Also make sure to hit that notification bell after you subscribe. That will alert you to our latest videos that you can't miss, and just information that you need to know as a healthcare provider. Have a good day everyone.